just not enough interpreters out there, especially for American Sign Language.
Let's be honest, we need more interpreters, and these interpreters need education and training and experience in order to provide these services in these kinds of situations.
Personally, as a deaf individual and as a professional who works within the healthcare organizations, I would like to see when healthcare organizations would invest in the community.
I think as the healthcare landscape continues to change, grow, and evolve, we're realizing that part of that effective communication is making sure that our patients feel empowered to make decisions over their own care. And so providing them the resources to be able to do so is critical and paramount.
I'm going to go ahead and get started. First, I'd like to introduce our panelists. Corey. Corey, can you pop your hand up? This is Corey. Corey Axelrod is a passionate social justice advocate and social entrepreneur. As founder and CEO of To Extend, he helps businesses and organizations deliver user-centric experiences for deaf and hard of hearing individuals. Corey is an excellent person to have joining our webinar today. He's got a wealth of knowledge, not only professionally, but personally. So thank you for being here today, Corey. Next up.
Thanks for having me.
Next up is Sarah. Sarah Serralta is coordinator of interpreting services at Northwestern Memorial Hospital. Sarah, can you give us a wave? Sarah is committed to improving patient health outcomes through communication equity. With a background in ASL interpretation and a passion for healthcare, Sarah works to foster inclusion within the healthcare system. She's a graduate of the University of South Florida's Interpreter Training Program and currently pursuing a healthcare-focused MBA with Case Western Reserve University. Thanks for being here, Sarah.
Thank you. So happy to be here.
My name is Liz. I'm your host today, and I'm connecting with you from as language access expert with Effectiff, where I work to provide education to the hearing world to ensure access. I have a Bachelor of Science in Deaf Education and have worked with the deaf community for over 15 years in various positions. And my passion is to drive equitable healthcare access for the deaf and hard of hearing community. And lastly, you'll see there are 2 interpreters on the call as well. We have Erin, who will be voicing specifically for Corey. So when you hear her voice, that is actually Corey speaking. And then Camille, who's going to be signing everything that's spoken. So depending on who's talking, that's what she'll be doing. So thank you guys again so much for being here. And really quick, I have another poll that I'd like to pop out to you guys just to kind of get your perspective here and see where everyone's at. So go ahead and take one quick second to answer this question. The question is, how comfortable are you interacting with a deaf person? Okay, so now we're going to go ahead and jump into a little bit about what we're going to be discussing today. So as you guys know, we have several different rules and regulations and governing entities that are managing and discussing and updating regulations and rules for healthcare and specifically equitable health access. And what does that look like? So, back in 2010, we had the ADA come forward with effective communication regulations. And those covered Title III entities like hospitals, any nonprofit, any entity that supports the public. And basically what they said was they provided regulations for VRI, for ASL interpreting, and effective communication for people with disabilities and their companions. That's something that's often overlooked or missed, that just because the companion is not the actual person that needs the treatment, that they don't have to provide an interpreter. So that's something I wanted to make sure we get in there. So I know recently we've heard a lot about 504 and 1775, and I just want to make sure that we understand that the point of it is to provide clarity and to give teeth to the Health and Human Services and the Office of Civil Rights to act on complaints. So when a service is not provided, there is now a very clear process to handle that situation. It also added Medicare Part B as a form of to be considered as a form of federal funding. So if you accept Medicare Part B at your practice or at your hospital, or even if you only get $1, it is considered part of these updated terms. So I just want to make sure that we have all of those. It also actually added telehealth to make sure that services are provided via telehealth, which it was kind of a gray area because it was new. So now we've got some definition there, and I think that's been a really good impact for community. So panelists, Sarah, Corey, do you have anything you'd like to add?
Not at this time.
All righty. Sarah? Good to go? Okay.
Likewise, good to go.
Perfect. All right, we're going to go ahead and jump into our questions here. Again, as I said, super excited to have you guys here today to join us and to provide your expertise. So my first question is, what are common misconceptions about what constitutes effective communication? I know there's a lot out there about, various ways and techniques to be able to communicate with someone. So what have you seen? What's your experience in this area?
I'm happy to give that question a go. It's a great question to kick off this webinar with. Thinking about the deaf community, it's so incredibly varied in preferences and needs. And one of the biggest challenges within the medical system is looking at deaf and hard of hearing individuals with a one-size-fits-all solution. We need to recognize that people have different levels of hearing. They have different preferences for communication, whether they speak for themselves or use American Sign Language or another manual sign language. I know we'll get into that later today. But I would like to set the expectation that there's two things to take away. One size does not fit all. And the journey for a deaf and hard of hearing individual within the healthcare system can change and in a result of needing different communication needs or preferences met as they navigate that journey. As they recognize that their communication needs might look differently in a one-on-one visit with a provider for a routine checkup versus being in an emergency situation within the emergency department, or maybe they've been are an inpatient. Organizations then need to be trained and equipped to ensure they have the appropriate knowledge and resources to provide all of the communication needs.
Excellent, Corey. Yeah, I definitely agree with you there. I know that training across an entire organization is so important, because you might call one department and they say, we don't have interpreters, but they just don't know. And I think that that's something that happens a lot. Sarah, what do you think about this?
Yeah, absolutely. I think some common misconceptions about what effective communication really is always remembering that it's a two-way street. I think sometimes we can always think that if I got across what I wanted to say, whether that's written down or showing you a computer screen or even communicating through a sign language interpreter, and I've said what I had to say, in a healthcare setting, that constitutes effective communication, but it really is a two-way street, and I think as the healthcare landscape continues to change, grow, and evolve, we're realizing that part of that effective communication is making sure that our patients feel empowered to make decisions over their own care. And so providing them the resources to be able to do so is critical and paramount.
Absolutely. Absolutely. I love that. That communication is a two-way street. We got to receive that information as well. So that's a very good point. Corey, anything to add after that?
No, I know we have a number of questions. I don't want to get ahead of ourselves.
Yep, absolutely. Okay, well, the second question is, in a healthcare setting, I have an interpreter, I have a patient. I'm talking to the patient, the interpreter is signing, and then suddenly the deaf person starts speaking. Do they actually need an interpreter? If they can speak, why is the interpreter here?
I'm happy to answer this one. Because really that is often my personal experience. You may notice that I am using American Sign Language today, and Erin is the sign language interpreter who is quote unquote voicing for me. And I am fourth generation deaf, and my primary language is ASL, but I am bilingual. I use hearing aids. I speak for myself. But in this context, I prefer to sign. Now, with that being said, because of the residual hearing that I possess and the use of my hearing aids, I do often speak for myself, and that often results in misconceptions about my ability to hear and to understand. To answer your question about if a deaf person really needs an interpreter, I would go back to Sarah's previous comment of communication is a two-way street. It goes back both ways. And I have a quick example that I would like to share with you. Long story short, my wife and I have twin boys. April 1st of 2020 was their birthday. Well, in COVID, that's a whole nother conversation for another time. However, going into the birth of our boys, we knew that the one baby boy, number 2, Jordan, would need to have open heart surgery in the first couple of weeks of life. We met with the interpreter coordinator a few months previous to their birth to discuss a plan. We set forth all of our needs, our preferences, and together we talked about how we can make communication effective for everyone. So as an example, we wanted to ensure we had 2 interpreters the day of the C-section. And the reason for that was I would probably go straight to the NICU and I would need an interpreter. However, my wife would need an interpreter as well, as she was to stay in recovery. The interpreter coordinator was like, oh. And I said, even though we speak for ourselves does not mean that we hear everything. I might be able to hear some things with my residual hearing. However, it doesn't mean that I comprehend everything. And that's the issue at hand. It was an important conversation to have. And I have many other examples that I could share with you, but I know that we're limited on time.
Wow. I can't imagine how challenging and scary that would be. And then on top of that, adding in the fact of having to coordinate your communication. And if you hadn't known that this might be a possibility, you wouldn't have been able to meet with that coordinator and get it set up if it would have been an emergent situation. Sarah, is there anything you want to add about, what that might look like in more of in something where it's unexpected, I guess?
Yeah, for sure. I think something that can be a little bit of a challenge is coordinating interpreter services, as we like to say, in the final hour, especially because I know at least in the Chicago area, that can be really difficult to execute. There might not be interpreters available, or they might be coming from far away, and in an emergent situation, it's going to take them some time to arrive. So I think that that's always a challenge or barrier that I keep trying to solve to. And I think one way that we can do that is providing opportunities for emerging interpreters that want to break into healthcare the ability to receive the education that they need in order to get the correct licensure to be able to interpret for these situations. Because let's be honest, we need more interpreters, and these interpreters need education and training and experience in order to provide these services in these kinds of situations. So I think, continue to keep growing the pool. And I, as an interpreter coordinator myself, am going to keep trying to plan for those emergent situations as whenever they arise. But I think something to think about is sourcing and how we can get better with sourcing, starting at kind of the root of the barrier for sure.
Yeah, that's an excellent point. I do know that it's been a ongoing situation for a long time. There's just not enough interpreters out there, especially for American Sign Language. It's something that, is not everyone has that deaf family member. So being able to get that language and really be able to become a proficient interpreter to handle situations like this involves a lot of training. Thank you so much, Sarah. Corey, anything to add?
I have a lot to add. No, I think Sarah touched on a great point with the shortage of interpreters. It is profound. And when I say we, I mean healthcare organizations need to foster the growth of the profession and the expansion of the number of interpreters within the profession. It's a huge opportunity to tap into. I personally, as a deaf individual and as a professional who works within the healthcare organizations, I would like to see when healthcare organizations would invest in the community, its resources, as they provide opportunities for physicians and pipelines. I would love to see that for interpreting, providing trainings and mentorship opportunities in order to grow their skills in the field of healthcare. I think more specifically, we need qualified interpreters who are working in that space, and not just in urban areas, rural areas as well. We are all being impacted. We are all being impacted in many different ways.
Yeah, I definitely agree with that. I know, especially in those rural areas, it's even more challenging. All of the challenges we see in the urban setting where we have more interpreters, but it's still not enough, is even more, there's even more of a shortage out in those rural areas. And Sarah had mentioned, when you're in an emergent situation and you're waiting for an interpreter to arrive, they might be driving from an hour away. They might be driving from 2 hours away. Just to make sure that that patient has access. So it definitely is a challenge. And I know that, the healthcare organizations are searching for answers. How do we solve this problem?
And if I may add, there are opportunities for healthcare organizations to work with interpreting agencies to have interpreters on standby, if you will. I know that type of system requires more of an expense because you're paying hour by hour. However, if in the end it improves the overall communication process, which then leads to many, many positive outcomes, meaning it impacts the patient outcomes, it impacts their positive experience, it reduces the amount of misunderstandings. I think that the list could go on. And I think that the healthcare organizations can be proactive in investing in that type of positive outcome for the community.
So what you're saying is partnering with local agencies to have interpreters ready for those emergent situations. So you can just call on them and they'll be able to come and support. That's a great idea.
Yes.
Excellent idea. Sarah, do you guys have anything like that set up?
Yes, kind of. Kind of what that looks like from my organization's perspective is specifically partnering with local agencies that have staff positions, because when we partner with those types of agencies and they have people on staff, that kind of functions in the same way that Corey is describing, where they have somebody on call that's available to take assignments, at a moment's notice or at short notice, and be able to kind of fill that gap.
Excellent. Excellent. Thank you.
I'm not sure if I understood you correctly. Sarah, did you say staff interpreters or deaf people? I'm sorry.
Oh, yeah,
I'm
yeah.
not sure if I understood correctly.
So, we partner with some agencies that have interpreters on their staff. So, for example, I'm a sign language interpreter myself, but let's say I'm not available for whatever reason, it's in the middle of the night and I'm out of town. I don't know, just making up a circumstance here. And we have, people that are after hours that are able to kind of call those agencies that we partner with. And because they have staff interpreters available, then they're able to send those staff. It's kind of functions like on call in a certain way because they have interpreters that are available at a moment's notice to fill jobs.
Great. That's what I thought, but I just wanted to double check, make sure I was on the same page.
Yeah, absolutely.
That sounds like an awesome plan, Sarah. I think that that'd be very beneficial for a lot of hospitals to maybe take on something similar as far as that setup to be able to bring in help when you need it. I like it. Really quick, I'm going to jump back to our poll and give my guests a break here. I'm going to go ahead and launch this now. If you guys could take a quick look at this and let us know where you are. How comfortable are you interacting with a deaf person? No wrong answer, guys. We just want to know where you're at. All right. I'll leave that open for just a minute and we'll keep going. All right. So my next question involves something that isn't necessary. It's not something that is very common, but it's something that's really important when it comes into play. An interpreter is at the hospital. They show up for an appointment or an emergent situation. The patient and the interpreter are communicating and the interpreter says, hold on, we need a CDI or we need a deaf interpreter. If we've already got an interpreter in the room, why do we need to bring in a second one? What is this about?
Sure, I can start.
Perfect.
So certified deaf interpreter, aka CDIs, can be really helpful, especially when we see a deaf patient presenting with that expresses themselves in a way that might not be considered standard American Sign Language. It could be somebody that's maybe from another country, or maybe somebody that experienced language deprivation and has not been formally taught American Sign Language. And this can look in a lot of different ways. I think another great example is maybe a patient that suffered a stroke and is exhibiting some atypical communication. And a CDI can be really helpful. And I like to describe it like this. If you're a doctor treating a patient and you realize that your specialty is not what's going to help this patient get the treatment they need, you pull in another specialist. Interpreters do that too, and they're called CDIs. So we bring in a CDI that is specially trained to communicate with patients that present with atypical language needs. And the hearing interpreter will work with that CDI in tandem because, of course, our hearing providers might not know sign language, and we kind of have that relay of communication happening so that everybody in the room is understood at all times. CDIs are vital and crucial to our patients that have atypical language needs, and it can be a little bit daunting at first. I know that when I show up with a CDI to an appointment here, if a doctor has not worked with one before, they can be really thrown off by how many people are in the room. But once they see how well it works and the information that they're gleaning from their consultation, it it's so worth it. It's so, so, so worth it. So that's how I like to explain CDIs is they have a specific specialty, a very specific skill set that they are highly trained to do, and pulling them in can make our providers and our healthcare staff's lives even easier because they're able to get the information they need to do their job.
I love that, Sarah. Thank you so much. That's an excellent analogy, and I will be borrowing that in the future. Corey, do you have anything to add?
Yeah, Sarah, I think that you really captured that, and I would like to mention some additional areas in which a CDI would be helpful, specifically if children are involved. Maybe they are still developing their language ability and their ability to express themselves. Having a deaf interpreter allows them to feel very connected to the interpreting process. Another scenario is someone who has typical language skills, but they're facing a high stress scenario, maybe in the case of sexual assault, abuse, trauma, mental health crises. The list could go on. But I think it's important that we ensure that it's not just providing one interpreter as one and done, but it's important that we're working with the appropriate stakeholders. Sometimes that includes a patient representative, the companion's a part of the conversation, and even the interpreting agency. Interpreting agencies have experience working with individuals in a variety of settings, or the type of situation that is at hand, and the interpreting agency can provide crucial advice. But at the end of the day, it's the hospital, the healthcare system's responsibility to ensure that effective communication is happening. The burden is on the healthcare organization to ensure they have the appropriate resources in place to make sure that they are adhering to legal requirements and ensuring effective communication is happening. Ultimately, the goal is to ensure you have a variety of resources in place. You have the network set up that you can tap into.
Absolutely.
Oh, and one more thing to add. The deaf person may have a physical challenge that creates the inability to have what you would call typical American Sign Language communication. And so I just wanted to mention those various scenarios.
Excellent point. And just to clarify, Corey or Sarah, this is not necessarily something that would be requested by the deaf patient. It's something that often also, or maybe only, comes from the interpreter.
Yeah. Oh, sorry. Go ahead, Corey.
Yeah, it's similar to VRI, video remote interpreting. There is resistance to having VRI. Sometimes with there's a stigma attached to working with a certified deaf interpreter, and it is similar in resistance to VRI. Now, the reason that deaf people are resistant to certified deaf interpreters is the misconception that CDIs only work with those who have minimal language skills or have some kind of detriment to their communication. Now, when my father was nearing his death, we brought in a CDI, and it was so beneficial. It would have been so beneficial, but there wasn't one available. And those individuals can catch things more intuitively than a hearing interpreter. Most interpreters, ASL is their second language, and they become immersed in the deaf community later in life, and they do not have that lived experience. But again, to Sarah's point, when you bring a hearing interpreter and a deaf interpreter to work in tandem, it benefits not only the deaf individual, but all of the stakeholders involved.
Absolutely. Yeah, we know the damage, I'm sure, that the smallest miscommunication can cause. So it's definitely better to err on the side of caution in situations like that. Sarah, did you have something to add?
No, I think Corey summed it up beautifully.
Perfect. Awesome. Thank you so much, Corey, and Sarah. So our next question then is, so we have a VRI vendor, and they said that VRI is perfect for interpretation. Now, whenever we get that out for our deaf patients, they're resistant. Why? Why are they why do they complain about the service?
Corey, did you want to take that first? And I can add on later.
I'm smiling because I think it's important that we provide any type of, when we're providing any type of language access service versus experience, that it's a component of the deaf community. We need to include those individuals who are receiving the services, what their needs are, what their wants are, what their preferences are, as opposed to just plug and play. Here you go. Here is a magic communicator. I have been on the receiving end of those types of experiences. And for myself, I do consider myself privileged in many ways, including that I do speak English for myself. I do have residual hearing, which I can benefit from using hearing aids. And yet I still have to navigate a healthcare system, and I am still working in the area of helping healthcare systems improve experiences and outcomes for deaf and hard of hearing individuals. When I think about the deaf and hard of hearing people who are interacting with your systems, many of them don't have those privileges, and they're very frustrated, and they're airing those frustrations on social media. And often the comments are, they were forced to use VRI. They were forced to such and such. And that's the problem. That's where the resistance comes from. Now, technology has improved light years over the last few years. If we're talking about VRI coming on the scene 10, 15 years ago, the technology was really quite weak, and deaf community members are traumatized based on that original system. Now, have they had positive experience since then? Yes and no. I've had positive VRI experiences, but I've also had pretty terrible VRI experiences. And it's important to go back to the point that both Sarah and I have made, and really the crux of this conversation today, is that we need to ensure that any communication is meeting the needs of the individual, and that individual is a part of the conversation of what will be provided to them.
Absolutely. I love that. Thank you, Corey. Sarah, anything to add?
Yeah, I mean, I totally agree. I think it all comes back to empowering patients to drive their own care. We wouldn't force a patient to take a medication that they don't want to take. So why would we decide how it's best for them to communicate? And as our community becomes more and more aware of the social determinants of health, communication and language access is definitely one of them. We know that access to effective communication or auxiliary aids that people need really affect their quality of life. And so, I know that there will be some LEP patients that prefer VRI for whatever reasons, but for many, it can also create barriers and logistical concerns for the patient. It might not be easy to move the tablet and navigate during a really physical consultation where patient and provider are moving around a lot. Um, that being said, I think VRI can sometimes be a great bridge solution. For example, we were talking about some examples of coordinating interpreter services in emergent situations. VRI can be a great bridge until a live interpreter is able to get there. I think that's something that VRI does very well. But I think something that I'm really passionate about is moving from a compliance mindset to an exploratory or excellence mindset. We would never settle for substandard care, so I think we should stop settling for substandard communication because it's just as big a part of their care. It's one of their social determinants of health as their treatment plan is. So I think that proceeding as such and kind of reframing that in a way can not put us into fear of whether or not we're complying, but get us excited and inspired about ways that we can be really exploratory or provide really excellent care.
That's awesome. I love that. Thank you, Sarah. Corey, I wanted to just pop back your way with a quick question. You had said, that the deaf community they're kind of traumatized, they're scarred from previous experiences or from, the community's collective experiences with VRI. As we've seen, issues that used to be present, like not enough tablets, networking, the tablet's not charged. No one knows how to connect to VRI. We're starting to see that these problems are kind of becoming less and less of an issue. Do you have any suggestions, or what would you say about trying to how to encourage or try to reframe that experience that the deaf community has had with VRI? I'm thinking more, specifically when there is not an in-person interpreter available and someone is very upset about it, and we've called everyone, we've exhausted our resources, it's not something where we can cancel. How would we frame that VRI in a more positive light for that member of the community?
That's a great question. I think there are two elements to my answer. First of all, the healthcare system needs to put in the work. Firstly. And what I mean by that is that the healthcare system needs to be taking proactive steps in order to provide VRI in an optimal scenario. Providing training to the team members as to how to use VRI and when it is appropriate to use it, and also when it's inappropriate to use VRI. Because if those challenges still remain, it almost contradicts us going to the community and saying, hey, use VRI. Secondly, when using VRI as a communication option, we know that technology is here to stay. If we can actually walk the talk, if we can make the communication and the conversation with the deaf community easier, I think we can think about how we can leverage the technology in different ways. and then actually sharing it with the community. I think that would be great. With one of my clients, I support their patient family advisory council. And that is specifically for the deaf and hard of hearing individuals in their system. And this exact issue often comes up in their conversations on how to engage the deaf and hard of hearing community in regards to different resources. And now providing an avenue for feedback to be received by the system. Oh, and then the deaf individuals are becoming brand ambassadors for the healthcare organization. So, leveraging the community network. And so instead of the healthcare system telling the deaf community that these resources are available, tapping into the deaf community, telling each other about these resources.
Yeah, I definitely think there's so much value to those community connections that we don't necessarily understand the full picture as a healthcare organization. It's not clear to us how impactful that can be. So I really appreciate you bringing that forward, because I think, the brand ambassador is such a good idea. It's definitely a good idea. Sarah, anything to add?
Word of mouth, that's what we call it, word of hand, is going to be your best ally. I mean, we see this amongst all communities. The Latino community talking to one another about the care that they received at XYZ place. LGBT community talking about whether or not a place offers gender affirming care or has gender affirming staff. The same goes for the deaf community. I think that we really need to leverage community outreach in healthcare organizations. We have folks that are a part of the organization reaching out, but how are we impacting people in a positive way that makes them want to talk to their community about the care that they've received?
Absolutely.
Yeah, I totally agree with Corey.
Mhm. Yeah, definitely. Word of mouth is everything. And it's a very tight-knit community. So that makes a lot of sense. Anything else to add to this question before we pop on to the next one? No? Okay. So this is our last question. Well, my last question. We are going to have a Q&A right after this. So stay tuned. The next question that I have is, how else can healthcare entities ensure communication equity for their deaf and hard of hearing patients?
Go ahead, Sarah. I might need just a moment to think.
Sure, absolutely. Something that I have learned and leveraged a lot in this community or in this role is that proactivity is always better than reactivity. So some strategies that I found work really well are asking the patient before they present to clinic, what communication methods do you prefer? And then honoring their answer and making the necessary preparations, because sometimes the deaf or hard of hearing patient does not want a sign language interpreter. Maybe they want a cart writer, or maybe they want all of their staff to wear clear masks. I mean, I think hearing loss, as Corey says, it's not one size fits all. So being proactive and saying, hey, what can we do for you before you come in day of to make sure that we're ready to provide you excellent service? That strategy has worked for us here at Northwestern really, really well, whether that's for in-person visits, telehealth visits, um, or if we know that somebody's being admitted for acute care. um, Always being proactive is going to help everyone, and you can always loop in more people to support.
I like that, the networking aspect there. Work with your teams, have a strong support system in place. That way, if you have a situation you're unsure of, you know where to go to get
Right.
some answers and to get some help. I love that.
Yes, because
Yeah,
at my job in interpreting services, I feel like I'm serving patients and I'm serving staff. I'm making sure that staff have what they need and they feel ready and adequately trained to care for patients coming in that need interpreting services. You know, it's those
absolutely.
two populations.
Yeah, I love the way that you brought that in, Sarah, because something that, I think of a lot is, and I know interpreters do as well. I'm not just here for the deaf person. I'm here for you too. I'm here for you. So, you want to be good at your job. You want to be able to get to the bottom of what's happening with this patient, and why they're so upset. They're there for you too. So I like that. Corey, anything to add?
I have several things that come to mind. I wanted to add to something that Sarah made mention of, going above and beyond. It's not just adhering to the letter of the law, but looking at what the spirit of the law actually has to say. I encourage you to think about the experience of deaf and hard of hearing patients and what they're going through and how they're receiving care. Not only that, but also the companions and patient representatives. The something that we talk about in the community is deaf tax, which means the additional burden that's placed on the deaf and hard of hearing individuals to ensure communication is effective for themselves. They take on a lot of that additional work. Just generally speaking, a person goes to a site for care, whether it be in the emergency room or a doctor's office, expecting services. And for deaf and hard of hearing individuals, there's this additional deaf tax, if you will, of making sure communication is effective. So I encourage you to reduce that, provide comprehensive services and solutions that will result in effective communication for them. I have one quick example for you. My father passed away in 2012. He had cancer and he struggled. He fought cancer. He had multiple myeloma. And his journey was terrible. The journey of cancer itself is terrible, but then if you add on journeying through cancer as a deaf and hard of hearing individual in the healthcare system, it was egregious. So I do want to mention one thing that I'll never forget. This particular incident happened about 1 week before my father passed. He had already received treatment in the hospital. He was preparing for a stem cell transplant at Northwestern Medicine, where Sarah is at now. But this is pre-Sarah from Northwestern. My dad all of a sudden developed sepsis and he needed to be intubated. I, at that time, was in Rochester, New York. So I flew home. My dad already had scheduled interpreters daily. And as I arrived, I remember it was Monday evening around 8 o'clock. There was no interpreter scheduled at that time. I was just dealing with the situation at hand, and I completely forgot about my own right to effective communication. I was just in the zone because I needed to figure out what was happening with my father. The next morning, my father's scheduled daily interpreter showed up and was like, wait, what's happening here? And the interpreter came up to me and asked me, hey, Corey, what do you need? And I realized in that moment that I had completely forgotten about myself. And as a result, language services got involved and they were able to arrange separate interpreting services for myself. Sometimes the caregivers are forgetting about their own needs. I was in survival mode using all of the tools at my disposal, like hearing aids and speaking for myself. But that interpreter brought me back to being able to get full access. And that was a way that they removed the death tax from me. And that goes a long way.
Wow. I can't imagine. I know, having recently lost someone in my family, that it's incredibly hard. It's so hard to be the person watching, the person there, and wanting to be supportive and wanting to, have every moment. And then on top of that, not having that access or having to fight for it. I wouldn't have had that in me. I wouldn't. I would have just been like, this is too much for me right now. I can't fight anymore. So I really, really, wow. Like, Sarah, even though it was before your time, A plus, A plus. That's awesome. That's beautiful to hear. Thank you for that story, Corey. Sarah, did you want to add anything there?
Just a final comment, it's a space of healing. A lot of sensitive and emotional things happen behind these doors. And so anything that we can do as healthcare workers to alleviate some of that cognitive load makes a huge positive impact on people.
Absolutely. Absolutely. So I am seeing some questions from our audience. I'm going to go ahead and dig in to some of these. So our first question is, could you list practical strategies to increase the number of ASL interpreters available in healthcare? Sarah, I know this is something that you kind of talked about before with it, and Corey as well, with kind of working with the pool. One thing I'll say is there have been a lot of interpreter training programs that have been shutting down. And that is scary for the deaf community. That's scary for the interpreting community. As far as what could be done, Sarah, do you have any suggestions there? Again,
Yeah,
how to increase ASL interpreters for healthcare?
for sure. I think just from my perspective and experience, some barriers to entry I notice can be access. So in order to be a sign language interpreter, let's just talk about the state of Illinois. In the state of Illinois, you're required to have some type of certification, whether that's through RID or BEI. You're required to have that to then apply for a sign language interpreter license in the state of Illinois. And that can be quite costly, especially for a new interpreter that is going through the testing process. There are multiple steps, all of which cost money. And if you are an interpreter that's also part of a marginalized community, it can be very hard to break through that barrier. I think immediately, our Black interpreters, our Latinx interpreters, LGBTQ interpreters who face a whole host of barriers outside in their everyday life. Access can be huge. So I know that there are a few projects and scholarships that make things a lot easier for people going through the testing process. Local chapters of registries of interpreters for the deaf offer scholarships. I know that there's also a rural interpreting project being hosted by the Katie Center over in Minnesota. So there are people that are passionate about increasing the number of sign language interpreters. And when it comes to healthcare specifically, I'll speak to state of Illinois. Having a space to practice where an actual deaf person is not at risk is huge. So being able to have education offerings that work in simulation environments so that interpreters can practice their healthcare interpreting skills before taking the next step in becoming certified or becoming licensed. I know that when I talk to novice interpreters, one of those, they're scared. They're saying, I don't want anybody to get hurt or because of my misinterpretation or my lack of expertise. So how do we solve to that? We create offerings and programming for them to be able to learn in a safe place, to be able to provide better services. So that is a project that I am working on at this time. Hopefully I'll be able to talk a little bit more about it soon, but for now, that is definitely something that I'm trying to solve to, um, creating a safe, risk-free place for interpreters to get healthcare interpreting practice and feedback from expert interpreters, experienced healthcare interpreters, and deaf individuals as well.
Excellent. I think Corey would like to, please.
Yeah, if you wouldn't mind if I added to that. I really appreciate what Sarah is working on. And I was thinking about the simulations and those mock scenarios with deaf and hard of hearing patients and actually having interpreters there. And you're killing several birds with one stone. You know, you're teaching the healthcare professional how to interact not only with the deaf and hard of hearing individual, but also how to work with interpreters. Plus, the interpreter is then leveraging that experience to have that healthcare training in a low risk scenario. I would like to actually flip the script with that question. I would suggest that healthcare needs to be providing language concordant care, which means hiring deaf and hard of hearing medical professionals who use sign language. Next week, I'm actually one of the co-chairs for the Association of Medical Professionals with a Hearing Loss, and our annual conference is here in Chicago. It's a great place to be, Chicago. There's going to be about 200 participants in attendance, and they are all deaf and hard of hearing individuals who work within the healthcare system. Some of them are looking for employment. So AMFL is a great place to come and hire individuals who can provide language concordant care, and that reduces the burden on needing to source interpreters. So I just throw that out there.
I love that. And,
Love
you know,
it.
I just feel like there's probably a lot of people that don't realize that deaf and hard of hearing people do work in the healthcare setting and are excellent doctors, nurses. You know, it's something that might not be common knowledge. So thank you for adding that, Corey. Guys, we are out of time, but I do have a couple really good questions, really interesting. I'm going to say interesting questions. They're good questions too, but one thing that I'm seeing here is, do we feel like the lack of ASL interpreters, the shortage of interpreters in healthcare is due to unsatisfactory compensation? Is that something that we're hearing? I think Sarah maybe, well, I mean, I don't know, maybe Corey would know as well.
Corey, did you want to start or? Sure. Interesting perspective. I think that we are living in unprecedented economic times. I can't say that sign language interpreters are the only profession that is being impacted by that. That being said, I think if I could just talk to a dream of mine, is that more interpreters are becoming on staff for all entities, not just healthcare, but having interpreters on staff providing full-time opportunities for interpreters is a huge opportunity for growth that I see in the industry. And I can't speak to unsatisfactory compensation models, but I know that freelancing can be really challenging for some interpreters. depending on your personality style, your lifestyle, your preferences, freelancing might not be a great option for you. And so what might you do? Look for staff positions. If you can't find a staff position, that might be another barrier into entry into the field. So
Mhm.
something that I definitely envision in the future is more interpreters on staff in more places.
Thank you, Sarah.
Yes, I think staff positions is an option, and also looking at having direct contracts with those interpreters and providing them with benefits as well. Health insurance is critical because most freelance interpreters, they're actually on their own. Maybe they have a spouse that can provide their healthcare insurance coverage. But if they're single and married, whatever their family situation is, that can be quite the burden for freelance interpreters. And so I think we could be creative in growing the pool by providing those ancillary benefits. Also, compensation is directly impacting, or I don't know if it is directly impacting the number of interpreters, but a few years ago, there was a shift, just how we live on a daily basis, how we work. And what I'm seeing is that more and more interpreters want to work from home. They want to provide interpreting services as they are right now virtually. And that happened within the interpreting community. And so I think that it requires healthcare centers, not to be reactive, but to be strategic in addressing that specific issue. What's happening within the interpreting community? Oh, the interpreters want to stay home. Okay, we have to be creative in creating those staff positions, providing those benefits. Instead of, well, the market is telling us this, we rather not instead. The market is telling us this, and therefore we should be strategically making plans to plug into what their needs are.
Thank you. That's an excellent point. I definitely agree about being proactive rather than reactive. And that is something, what you're saying about interpreters wanting to work remotely, that is something that we saw during COVID, is when it really, you get that taste of working from home and you can't shake it. You just want to keep it. So it's definitely something that we've seen. Another question, and Corey, I'm going to direct this one to you, or to your expertise. So deaf individuals communicate remotely among themselves through video interfaces such as FaceTime and others. Sometimes this reality contradicts the common refusal to use VRI in the healthcare setting. Could you please help us understand this apparent contradiction?
I personally struggle with that one myself. It is an apparent contradiction. However, having lived experience of being in a situation where healthcare information is so critical, it is in fact a matter of life and death. And so we want to ensure optimal communication, not substandard communication access.
Absolutely. I will add too that, when you're communicating on FaceTime or through a Zoom call with your friend or your cousin, or, something like that, you're comfortable with that communication. You're comfortable with the person you're talking with. You're comfortable in the environment. It's not scary. You're not, maybe you are sick, but you're, ideally, typically those kinds of conversations are more comfortable. They're more casual. They're not life and death at sometimes. So I think that can definitely impact that conversation and the experience that you're talking about there. Okay. Last question. All right, so the biggest challenge I've noticed with VRI as a VRI employee is the lack of network ability. This is huge, guys. This is something we see in all hospitals. Internet issues, freezing, the lack of training, the healthcare workers don't understand how to use an interpreter. And when they're stuck behind a screen, the interpreters have a limited ability to advocate for needs. Education is huge. Best practices, internet requirements, education, training to staff, and ensuring qualified interpreters are the ones working in VRI is also vital. I love what this person mentioned here because, as I said, you know, networking in the hospitals. I'm there as a patient. I can't connect to the Wi-Fi. I can't connect to anything. You're trying to watch a show on your tablet. Okay, well, so now let's bump this up a little bit, raise those stakes. And now we're trying to actually facilitate communication through a tablet. Something that, hospitals can do is have a dedicated network, a dedicated line for VRI. I'm going to go ahead and reach out to Corey. Corey, you got this. It's yours.
Yes, from my experience working with healthcare organizations, I've seen the gamut. And once an organization has been sued, typically they're the ones that don't have a VRI policy on board. They might have best practices or recommendations of what to do. But with the recent changes to the 1557, we must have policies in place. It is an expectation of the Joint Commission that hospital systems are in compliance. And it's not an option. It's not an optional thing. It's not a if we want to kind of thing. We must have protocols, procedures on the books.
Excellent. Thank you, Corey. Sarah, anything to add about VRI?
I definitely think that as we're talking a lot about network, roping in other teams, making sure that we not only provide training to employees, but also looping in people to create a feedback loop, who are using the services because, I'm working in in-person interpreting services. So VRI is not a product that I am using. So I need to make sure that I am plugged in to my organization, making sure that people know where to go with feedback, you know, policy and recommendations aside, all of those things set in place, you know, how do we troubleshoot issues or how do we know that a network issue arises? It's creating that feedback loop and making sure that as interpreting services, I have a presence on campus and I'm making sure that people know where to bring that feedback and also making sure that I have contacts with VRI providers to ensure that I have a place for that feedback to go.
Awesome. Thank you, Sarah. Corey, anything to add?
Yeah, and as a user of VRI services, I'm often amused by the feedback, the opportunity to provide feedback at the end of a VRI call. I never know if I'm supposed to click if I'm satisfied or not, or if the healthcare professional is supposed to make those selections. So who at the end of the day is providing this feedback? And Sarah makes a great point about these feedback loops in which you receive feedback from the end users, the deaf and hard of hearing individuals, the staff personnel, or is it the deaf patient themselves, or is it individuals who have limited English proficiency? So again, these feedback loops are great, but what type of data is being collected? And I think we need to ensure that it is disseminated and stratified appropriately.
Yeah, that's so true.
Definitely agree. All right, guys, we went over on time. We had such good conversations, though. I really appreciate, I wish we had more time. Maybe we can set up another one and have a follow-up chat. But thank you guys so much for being here. Sarah, Corey, interpreters, Aaron, and Camille, thank you. I really appreciate your time. And thank you to our attendees for joining us today. I hope that you got some good information to take away. Thanks, everyone.
Thank you so much.
It's really nice to be here.